reverts back to the natural state as the nature intended it.
What is the life expectancy of dental implants?
Dental implant is as close to the nature as it can get, as I said before. And dental implants have one of the highest degree of success in medical devices. We place 100 implants today. In 10 years, we expect to see between 90 to 97, 98 of them to be in function, depending on where they are in the mouth and how much bone the patient had at the beginning. So at this time, dental implants are done with the idea of be a permanent solution to the problem.
Dr. Eslami, can you tell me what is pyorrhea?
Well, pyorrhea or periodontal disease or gum disease is one of those diseases that a lot of people in population have. It's a major cause of tooth loss in adults. And of course, pyorrhea, it's good that you asked me that question. It's not being used as such scientific nowadays. It was the name that was being used in the past, and still some people, actually lay people, use that. And when you say pyorrhea, it all of a sudden just creates a fear in patients' eyes. I can see that. But when you say periodontal disease, somehow it doesn't instill that kind of a fear. Yet it's the same. Especially nowadays, the knowledge has come to a point that we see the relationship between periodontal disease or gum disease or pyorrhea and the systemic conditions, like the health of the heart, kidney, liver, and low birth weight in women who are in the childbearing ages. So it's not something to be taken lightly and easily. So definitely, if a person is told that they have pyorrhea or gum disease, they need to do something for it.
What is the treatment for gum
Well,
disease?
I will talk about it, but let me say a couple other things about pyorrhea periodontal disease. It is a painless disease. So that is why a patient, when a person is told they have pyorrhea or gum disease, they often look at you with a question mark and they say, oh, I don't have any pain. And that question even becomes more interesting when they realize it's, again, an infection. And say, well, I know I've had infection. And then when I talk to them and say, periodontal disease is among some other diseases which are very serious but don't have any clinical manifestations, like high blood pressure, like diabetes. This is a very serious, yet many people don't know they have it until someone tells them. So again, as I said, it is one of the most serious diseases that people can face, and of course treatment is there and it can be done. So I'll talk about the treatment.
Mm-hmm.
The disease cannot be reversed, the damage. What the periodontal disease does, really, its relationship to the teeth is the same as termite to a house. Termite goes into your basement and affects the wood and the studs, and then one day you go to your basement and see a lot of supporting beams are infested, and you question, when did it come, why didn't it get my permission to come, there was no noise, there was no smell. Periodontal disease really creeps in like that, and it gradually damages the foundation of the teeth, which is bone, not the gum. And the bone which is lost is permanent. That's one of the things, again, many people do not realize. They come to me and say they would like me to treat them, and what they really mean, and when I again interview them, they want me to take them back to square one. That cannot be done. They have to realize that. Yet it can be treated, and the treatment is really more like stopping it. But there is also some concern there, because as the disease advances, the treatment becomes more and more difficult. And I usually explain to my patient, if you think about gum disease like a train that started from station number 1, and station 10 is really when the train crashes. As the train starts, it gathers momentum, And then as it passes session 5, kind of halfway point, it becomes more and more difficult. Again, you cannot reverse that train, but can be stopped, especially in the higher numbers when they are in the top 50% of the breakdown.
Does this require surgery or what?
Yes, periodontal disease basically at the earlier stages maybe just as easy as a patient improve their brushing and flossing. And of course, when a patient is told they have periodontal disease by the dentist, that's a little bit too late for them to do it. The dentist often does what's known as scaling root canal or deep cleaning, but it depends on the stage of the disease. It may not help them. It's definitely a first stage. It's very much like you have rust in your car, and the very first stage is to use a sandpaper to remove the rust, but still you have to proceed with the treatment of that rust before the treatment is complete. And the traditional treatment for periodontal disease is really surgery or gum surgery, which is done by numbing the patient and flapping the gum open. And then they say it doesn't have a good reputation out there. Many patients come, they've heard the horrible stories now from their friends, co-workers, family, and it has created such a fear in their minds that sometimes they just don't want to do anything for it. And of course, when you talk to them and say, it's a one-way process, sometimes they become convinced to do that, but usually the fear is really overwhelming.